I was tired.
This
We all need to
morning, I
listen
was
to this.
racially profiled at CVS trying to get my medication, and I need your help getting my justice. This occurred at the 24-hour CVS on Curry Ford and Goldenrod. It was 3 a.m. I was in pain. I went to go pick up my medication. I was already ready for pickup. Upon arrival, I was greeted with a very nasty attitude from the pharmacist, Ahmad Mohammed. He was the only pharmacist there, and he was very disrespectful towards me. I gave him, he gets my prescriptions. I noticed that he rang up my prescriptions at the drive-through register, even though I was at the front register. And I look in the bag and I'm like, oh, you already rang up my prescriptions. Where's the receipt? He says the receipt is in the bag. I said, oh, I wanted to get these two snacks. I look at he's like, we don't charge snacks at the pharmacy. I'm like, okay, fine. I look at the receipt. I notice there's 4 prescriptions. I'm only here to pick up 2. So I said that to him and I said, I need an updated receipt. He was like, no, you don't. You can just go. I'll put the other prescriptions back. I said, no, I need an updated receipt. He is very agitated. He gets upset. He returns the other 2, comes back, slams a paper and a pen on the counter and is like, you need to sign this. And I said, what is it for? And I read it. He's like, oh, it says what it's for on the paper. On the paper, it says I authorized them to charge my insurance for 2 prescriptions. And so I was like, can I see the RX numbers? Because I had 2 RX numbers on the paper. I said, you're holding 2 prescriptions. Can I see the 2 RX numbers so I know that this is right? Because you just returned 2 prescriptions that I didn't need. Before I sign this, I need to make sure that the RX numbers match. He's like, no, you could just sign it and then I'll show it to you. I said, no, it doesn't work that way. As I'm reading the first prescription, I notice it doesn't match, and I say out loud to him, I was like, sir, this doesn't match. He's like, yes, it does. He starts yelling. He's getting agitated. I'm like, no, it doesn't. As I'm reading the second one, he snatches the prescription from me, takes away my snacks, and he tries to grab the second prescription, but I'm holding on to it. I'm like, sir, what are you doing? Why are you doing that? He's like, you're not getting your medication tonight. You have to go come back in the morning. I said, what is your problem? Why are you doing that? He's like, oh, well, you don't want to sign the paper. I said, that's not what I said. I said the prescription didn't match. Is it, if it doesn't match, you're not going to get it, da, da, da. And I said, sir, it's 3 o'clock in the morning. I'm getting my medication tonight. He denied me my medication. He took away my snacks. I was like, why did you take my snacks? He was like, you're not going to pay for them. Obviously a lie because I tried to pay for them and you just told me that I don't pay for I don't pay for snacks at the pharmacy. So I was going to go at the front anyway. He was like, how do I know you're going to pay? At this point, I clocked it. I realized what's going on. This man is obviously being racist, discriminatory towards me. At the end of the night, I ended up calling the police to get my medication. At the end of the night, I never got my prescriptions back. I ended up leaving with a trespass warning to the pharmacy. And then on top of that, when the police came, Ahmad, the pharmacist, disclosed the name of my medication to the cop. That is illegal. That's a HIPAA violation. And I know my rights because I'm a licensed and certified pharmacy tech for 5 years. And I actually used to work at CVS, so I know the procedure. Ahmad, the pharmacist, needs to be fired. I'm going to get my justice and I need your help. Please tag CVS, tag any lawyers in Florida that would take my case because at the end of the day, I'm still in pain. I still did not get my medication and I got trespassed for sticking up for myself. So I need your help.
My goals of my platform is to always advocate for the pharmacy profession. However, when someone is doing something that is inappropriate or wrong to another patient, this is when I have to use my platform to call them out. And luckily that this creator is a pharmacy technician, so she knows the laws, she knows what she is able to get, what she isn't able to get. And luckily, she realized that she was signing for something that she wasn't even picking up. And I completely understand that, retail pharmacy is so stressful right now, but we also have to make sure that we're not breaking laws because you can't ring out for 4 prescriptions if the patient is only trying to pick up 2 prescriptions. And then also just a heads up to everyone, if you are bringing a couple things to the pharmacy and you're ringing out your prescriptions, then there is no problem for you to have those rung out. And I really hope that this pharmacy technician gets her justice. And I really hope by using my platform and, I have a large pharmacy audience that we make sure that we do not do these things to patients.